Hi, I'm Dr. May Seibel, editor of My Menopause magazine. I recently interviewed Hollis Herman at the annual meeting of the North American Menopause Society in Dallas, Texas. Now here's what you're going to learn about. You may think that physical therapy is just for your back, but you're going to find how it can help you improve your sexual function. So first of all, I'm going to ask you just to state your name.
My name is Hollis Herman.
And tell me where you work.
I work a number of places, but the most important place is Healthy Women, Healthy Men. It's in Cambridge, Massachusetts, right between Harvard and MIT. And also, I am a faculty member for Herman and Wallace Institute. So we have 65 courses on the pelvic floor and pelvis all over the world. And at the end of this month, I go to Saudi Arabia.
Wow. So tell me a little bit. I just heard you give one fantastic discussion. It was chocked full of information and very funny. And I hope you will tell us, first of all, something that's very serious, is that in the context of today, how often do women actually have sexual problems in and around menopause?
Oh, it's dramatic. Nobody is talking. As we saw, 3% of people talk spontaneously to their physician, and even when they're asked, the doctors don't quite know what to do with it or how to go about asking the information, and they don't know who to go to. So it is enormous. And it can be a musculoskeletal problem, it can be a combination of that plus a hormonal problem, it can be a comorbidity with autoimmune, so there's just many reasons for that.
So we have a common problem that affects as many as 80+% of women in and around menopause. And one of the things I thought was really fascinating is, when we think about physical therapy, I hurt my back, I get physical therapy. I hurt my knee, I get physical therapy. But now we're talking about physical therapy for a woman who may have a sexual problem. Tell me a little bit about that.
Yes, I believe that all women should, and every patient that walks in my door, both women and men, should be asked about bowel, bladder, and sexual function. It's just absolutely vital for their well-being, for their self-esteem, for who they are. And so with those women who have sexual problems or sexual dysfunction, oftentimes it's a orthopedic problem. Their hymen is too thick. It doesn't allow elasticity, and it's something very simple that can be taken care of. Their hip won't allow them to open up their legs. That it can be a biomechanical problem. It can be a problem with having had a problem with intercourse and it was painful, and now the muscles don't ever want to let anything back in.
So what happens is you've got a woman who's actually suffering from a physical pain. It may be her back, her hips, her legs won't stretch or spread. And it could be something that could be totally treatable by getting physical therapy with the notion of approaching her pelvic problem.
That's correct. That's correct. And if only I could spread the word more to doctors so that they would refer patients to physical therapy. If it could get out in magazines such as yours, if it could be in lectures such as you give and where you travel, to let people know that physical therapy is really an option, it would be so much better.
So for a woman who comes in and she may not have ever thought about physical therapy, how might she know she needs someone's services such as your own, and what might she expect at a visit?
Yes. Well, if she comes in for her back pain or comes in for a sacroiliac problem or a hip problem, with asking her, do you have any problems with bowel, bladder, or sexual functioning, you can find out that there is something that's going on, that she's not able to have intercourse, that it's painful afterwards, that she has problems in certain positions, that she's not able to orgasm, that she has very little desire, and she used to have quite a lot of desire. So working as an interdisciplinary team member, we then work towards getting her to see her physician or her specialist, and then get a referral so that she can then proceed along and get the problems taken care of.
And is this something that they would come to you directly for, or their doctor would need to refer them? How would they end up getting to a physical therapist to help their sexual dysfunction?
Yes. In Massachusetts and 21 other states, there is laws that say that a person can walk off the street and I'm allowed to treat them. I do not need a doctor's order. In Pennsylvania you need it, but not in Massachusetts. In Rhode Island you need it, but not in New York. So people can actually walk off the street and come and see me, or hear from a relative or somebody else that this is available for them, or that they had a family member who is sending them there. But I think that it's really good medicine in order to have an interdisciplinary team approach to make sure that there is nothing that is medically wrong or problematic that I would miss. And so I like to have patients screened by doctors and also have hormonal baseline work so that we can see what else they need.
So in essence, to kind of sum up what you're saying, if a woman is having difficulty with a sexual problem, and she notices, by the way, that she's having back pain, leg pain, knee pain, any kind of a physical discomfort in her skeleton or even vaginally, you would be somebody that she could go to see if there's a contribution from her anatomy that could be fixed.
Exactly. There's so many people who have been helped with their urinary incontinence by working on strengthening the back muscles and the pelvic floor muscles. There are so many people who have been helped from prolapse and organs descending by doing core exercises. So people actually get benefits without even knowing that they're getting benefits because of exercises that may have been to another body part. But it really would be so great for anybody who is having any sexual concerns to be able to feel that they have the ability to go see a physical therapist and get these areas treated.
And how might they contact you?
Yes, they can treat. I'm on the. I have my own website, so it's www.hollyherman.com.
Spell that for us.
HOLLYHERMAN.com. And also I am on Herman Wallace, Herman, HERMANWALLACE.com, and I'm a faculty member, and they could find, we also have locate a therapist on that website, so if there's somebody in a different state or a different part of the state, we can find somebody to treat them.
Thank you so much.
You are very welcome. This was really an honor.